Hello everyone, myself Deep Dinesh Bhoir, studying in final year B Pharm. Today my topic is pharmacokinetic and pharmacodynamic drug eluting stunts in cardiovascular disease, guided by Dr. M.S. Nangurde ma'am. Abstract: the drug eluting stunts system is developed to treat coronary lysin by allowing in situ customization of stent length. The primary aim is to compare the effectiveness of the drug eluting stents with bare metal stents in managing coronary artery disease. Keywords: drug eluting stents, pharmacokinetic, pharmacodynamic, adverse drug, biodegradable stents, drug specific effects, and personalized medicines. Introduction: drug eluting stents keep coronary artery open evolving from 1977 balloon angioplasty, and the first bare metal stents in 1986 developed by Sidgwick's EL in 1986. Endovascular prostheses are commonly classified as bare metal stents or drug eluting stents. Distinguish between purely metallic stents and those release medication to prevent restenosis. Pharmacokinetic drug eluting stents. Drug release mechanism: polymer coating. Polymer coating are essential for most drug eluting stents due to inability to adhere directly to the metallic surface. This coating play a critical role in the controlling drug release kinetics, which can be optimized by utilizing multiple polymer layers to achieve the desirable drug delivery profile over the time. Diffusion: we developed two-dimensional numerical model to explore drug transport in drug eluting stent, focusing on both the vascular walls and the blood lumen. The study how drug diffusion coefficient in three main components: the blood, the vascular wall, and the polymer coating affects the overall transport process. Erosion: drug eluting stents are designed to release medication gradually through a process of a polymer erosion. These stents are coated with a specialized polymer layer that degrade over release of the drug in controlled manner directly into the arterial tissue. Distribution: in the drug distribution, drug eluting stents refers to the controlled release of the drug from the stents into the surrounding tissue. In cardiovascular disease, drug eluting stents are used to prevent restenosis, re-narrowing of the artery, and improve clinical outcomes. Metabolism play a crucial role in the efficiency and the safety of drug eluting stents in cardiovascular disease. Once the drug is released from the stents, it is metabolized by the body, which affects into the concentration and duration of action. Excretion: in drug eluting systems for cardiovascular disease, elimination is the final stage where the drug like sirolimus and paclitamus are removed from the body. This process occurs mainly through the kidney, which some binary excretions. Pharmacodynamic drug eluting stents. Mechanism of action: inhibition of proliferation. In drug eluting stents for cardiovascular disease, inhibition of proliferation prevents excessive growth of smooth muscle cells in the artery, reducing the risk of restenosis by keeping the artery open longer after stents placement. Efficiency: drug eluting stents has demonstrate high efficiency in treating cardiovascular disease by reducing restenosis rate and improving clinical outcomes. Study has been shown that drug eluting stents restenosis rate by compare 70% to bare metal stents. Adverse drug thrombosis. Stent thrombosis is the rare but severe complication that occurs when the blood clot forms a stent placed in a coronary artery, potentially leading to heart attack and sudden cardiac death. Stent thrombosis is categorized by timing: acute, subacute, late, and very late after 12 months. Novel approach in drug eluting stents. Biodegradable stents. Polymer that release on stents after complete drug release can increase the risk of thrombosis and linked to hypersensitivity and inflammation reaction. Several synthesis biodegradable polymer has been explored for the stent coating, including polylactic acid, polydilactic acid, polylactic co-glycolic acid (PLGA). Combination therapy. Combination therapy involving drug eluting stents have demonstrated enhanced effectiveness in treating cardiovascular disease. One such approach pair sirolimus and pactolimus, which has been shown to lower restenosis rate and improve clinical outcomes. Personalized medicine. Personalized medicine in drug-eluting stents is an emergency approach that tailors treatment to individual patient needs by considering factors such as genetic profile, medication history, lifestyle habits, clinical, and can optimize drug-eluting stent selection and improve patient outcomes. Conclusion. The safety and effectiveness of the drug-eluting stents vary depending on the study, but generally they are shown to be effective in reducing the need of revascularization and in lowering adverse cardiac events. Thank you.